I've got a passion for working with our children and our families towards permanency, and specifically with the goal of adoption. So a brief overview about what we're going to cover today. I'm going to tell you a little bit about Fairfax County and who we are, and a little bit of back history about our history in Fairfax. I'm going to talk a little bit about the review that we did with cases within our county, and how we link the project that we're doing within Fairfax to my MPLD project. And I'm going to talk to you about my research project around supervision and providing a framework for supervisors to advance our cases and support the permanency work of our staff. I also participated with my team, supervisors, in a focus group, and we piloted a tool that I developed to help support the work that we're doing with our staff. I'm going to talk to you about our pilot results and some of the feedback I received from our supervisors, and some of the next steps and the impact that this program and fellowship has had on myself and my professional growth as I move forward and in the work that we do together. So a little bit about Fairfax County. We are one of the largest counties in Virginia. We have approximately 103 ladies or females within our foster care and adoption program as of July of this year, and about 97 males that are in our program at this time. And we work together with our foster care counterparts and other programs within Fairfax County to support permanency work with those children that we have in foster care. So a little bit about who we are and our demographics. And we pulled some of this data from our US Census as well as our statewide data system that we all utilize across the state of Virginia. So as you can see, we do have a disproportionality issue, which is very similar to other jurisdictions and states. And if you look closely at the data, when you look at our African American youth within Fairfax County, they comprise 11%, and we have a 29% population within foster care, as well as our Hispanic and Latin population. Our Virginia statewide system does not break down the data the way that we'd like. So we have our own internal data system within Fairfax foster care, where we have a 31% population of our Latin and Hispanic children that are in foster care, which only comprises 17% of the Fairfax County general population. And then we have a small percentage of multiracial children that are in Fairfax County as well, and a 12% representation in our foster care system. Some of the other data that you see here are not as significant within Fairfax. So our highest population of minority children are Hispanic, Latin, Latinx, multiracial, and African American children. So I wanted to give you an idea of the ages of the kids that we have in our foster care system. So as you can see, it ranges. I think earlier in my career, we had a larger population of younger children. It's sort of shifted to our middle-aged kids and our older youth, which is probably similar across the entire country, as well as our permanency data. So specific to adoption, in July of 2021, we had 22 kids with the goal of adoption, achieve that goal out of 78 kids total with the goal of adoption. And then if you look at our overall data, which we had 184 kids in foster care at the point in time that we pulled the data in July, with various goals. And out of those children, 62 of those children had the goal of adoption and achieved that goal within that time period. So a little historical data, back in 2011, myself and our quality assurance team and several point people within our agency decided to really look at our cases and our data closely. And we completed a qualitative study around timely adoption. And we wanted to look at some of the things that were working, some of the things that were barriers, and what were our challenges. At that time, our critical outcome scorecard, so Virginia really looks at our successes and our challenges across the state and compares jurisdictions. And at that time, Fairfax County was achieving our state and federal performance goal at 20% for children with the goal of adoption finalizing within 24 months. And really, we wanted to improve that goal to 35% or higher. Right now, our state mandate is really 40% or 45% or higher. And we were at 20% when we looked at this data back in 2011. What we learned from that qualitative study was that we needed to have a narrow focus on what those barriers were and how we were going to move our cases based on those challenges towards the state and federal performance goal. We wanted to identify the impact that this was having on our minority children and youth, explore and highlight the successes we were seeing and how we could elevate and expand those successes. And last, really implementing additional best practices that were proven to impact the kids that we were serving so that we could shorten the time that they were spending in foster care. Which leads me to some of the research and conversations that I decided to have that support my plan towards my PICO. So some of the key conversations that we had were across jurisdictions, with other counties around what they were seeing related to permanency. So myself and several key individuals in my team partnered to have key conversations with jurisdictions in Ohio and Vermont to talk about best practices, talk about permanency planning and some of the data that they could share with us about what they were seeing in their jurisdictions. These were counties that were similar to the size of Fairfax County and the population of children that we had in foster care. What we learned from those conversations really were key to the direction that we wanted to go on and looking at ourselves internally about programs such as 30 Days to Family, where we're really searching for families early on in cases when children first enter foster care and the successes that other jurisdictions were seeing with that. Having roundtables with youth in conversation towards their permanency plan and having them be key contributors to those conversations. And really being able to have data to back up what we were saying were successes and the areas that we were seeing that were challenges. Some of the other practices and things that we focused on were having conversations with our staff and our supervisors so that they had buy-in in regards to the direction I wanted to go in with my research project. As I mentioned before, we conducted a very large case review and asked our staff to contribute and support in looking at our cases closely and reviewing those results and pulling quantitative and qualitative data to inform where we wanted to go as an agency. As a result of some of this background process that we went through, I developed a supervision and coaching guide, piloted it with supervisors, and conducted a bi-weekly feedback session with my program manager and the supervisors about how it was being used and whether it was being helpful towards supporting the plan for permanency for the children that we serve in foster care. In the end, I also received feedback through a survey that informed, the direction that we wanted to go in next. So, as part of the background work that I did towards my PICO, which I'm going to get there in a minute, myself and my program manager and several members of our team decided to pull together a case review in support of the work we wanted to do internally in Fairfax, as well as partnering with MPLD to support my PICO that would help us figure out where we wanted to go with the work that we saw was going to be a challenge. So we pulled 28 cases, but in the end, it was really 24 that we really buckled down and were able to review in depth. They were randomly selected, and we reviewed them based on a tool that we developed as a team on key questions that we wanted to ask ourselves. We utilized the equity lens because we wanted to see how were things impacting our families based on race and ethnicity, and were they receiving the same level of care and service as other members of our families and children. We did a complete data analysis, which really highlighted our strengths and the areas of opportunity and this included, where my PICO comes in, that there was no really documented, consistent place that supervisors had a footprint to guide our staff on direction that we need to go in support of our families and children. So from that case review, some of the results that we received from that was really looking at the time frame that it was taking for our children to achieve permanency, specifically the goal of adoption. So the cases that we looked at, the time frame range from 19 to 15 months that children were remaining in foster care before their adoption goal was achieved. The median and mean times were pretty much the same, around 35 months. So as you can see, based on that information, our kids were spending a lot of time in foster care, and we really wanted to, look at specifically how we could impact that and where are the areas that we were struggling and the areas that we were doing well. So we really broke it down by time frame, which I thought was really powerful. From the time of entry to the end of finalization, where were we seeing the most stuck spots? So we looked at the 5-day hearing. While they were not happening on time, we didn't see a significant impact in the overall 24-month time frame. We looked at the 60-day dispositional hearing. We did see that they were 60% or higher delay in the cases we reviewed, but overall, a low impact on the final timeline. And as you can see, the main area that I think was a significant player was around the 6 months to 12-month mark, as well as at the permanency planning hearing mark, where we saw the most significant delays. And some of the things that we learned were issues around publication to our fathers, continuances, which I think Brandy talked about in our previous presentation, appeals, and children being placed out of state and how long that takes to have our relatives and kin certified. Specifically, we also brought down the adoption process from the time the case comes to my team, once we have termination of parental rights, to the time that we finalize the adoption. So when we initiate the paperwork with our adoptive parents, to the negotiation of the adoption assistance agreement, to filing in court the petition and the judge signing the final order of adoption. So while we saw a significant impact on delays around 60% or higher, this was one of the strengths where it wasn't a consistent delay across the entire process. So there were areas that we could tweak from the time that the case comes to our team to the time the adoption is finalized, that we could shorten this time frame from 8 months to 6 months. But overall, our practice was a success. So a little bit of data so that you have an idea of who these kids are and where they are living. I thought it was important for you to have a sense of that. So as of October, 43% of our children were in a licensed placed organization or association or our treatment foster care organizations. They were 19% were with a relative, 32% placed with our own department approved foster homes, and a really low population of children in congregate care. And I really wanted to highlight that because we've worked over the last 10 to 15 years and really supporting our kids remaining within their family and out of congregate care. Some of the strengths that I wanted to highlight that we were able to acknowledge and document was really the fact that we were addressing the needs of our children. We were addressing the needs of our parents, and we were making sure our children and our youth were at the table and that they knew what was happening and had a say in what was happening on their case and wanted to be a part of the process, as well as the fact that we had a streamlined process from the time a child entered my unit in the adoption unit to the time their adoption was finalized. Some of the areas that we really needed to work on and had areas to explore opportunities was around finding our relatives and engaging them early in the process. I mean, I think this is not unusual for everyone that's on this call, but this is an area that we struggle with nationwide, how we find our relatives, support them, engage them and approve them to be a placement option for our kids in foster care. Making sure that our staff are prepared and are able to identify and support families well. We talked about trauma-informed practice and trauma-informed care, and making sure that we are having those staff that are going to be engaging with our families trained and prepared to be able to support them well, so that our kids can remain in their homes through permanency, and specifically with the goal of adoption being finalized. Being able to transition our cases from our foster care unit to my adoption unit. So in Fairfax County, we're very specialized. So we have a separate partnership, but separate foster care units. And then my unit, which is one adoption unit within Fairfax County. And the cases come to my unit once we have termination of parental rights. And what we found in the review was that there was significant delays in cases transitioning to my team in a timely manner. And last, which is where my PICO comes in, is we really were not able to find documentation that was consistent around supervisors' guidance on the case, and anywhere that was documented both in our statewide system and our internal system around those key conversations that you have in supervision with your supervisor. So some of the actions that we agreed to as a team in support of my PICO and in support of the work that we found in the reviews, the cases that we reviewed, was really establishing clear policies and process for how we identify our relatives, search for them, and engage them. We wanted to document a clear way of transitioning our cases within a 30-day time frame and have a tool to be able to support that, so staff knew exactly what they needed to do to accomplish that within the time frame that we needed. We wanted to formalize an early identification process and matching tool so that our resource families were available and matched with our kids well. And last, develop a standard around supervisors' intervention and documentation with staff. So my PICO, my research question or statement: if supervisors learn to provide guided supervision and coaching to foster care and adoption specialists, to teach specialists how to conduct adoption teaming, ongoing relative and kinship engagement, recruitment and support of foster and adoptive parents, improved trauma-informed practice, and consistent, timely, concurrent planning with the goal of adoption for our youth in foster care, specifically African-American, Latino, and other minority youth, would it change supervisor and staff practices and ultimately result in a decrease in the timeline towards adoption finalization? So the next step I took after our case review was really having this information pulled together and presented to my fellow supervisors. There were supervisors that had been with the agency for several years, such as myself, with a lot of experience, and newer supervisors who had newer experiences in managing a team. So their experiences ranged and their background ranged as well. I shared with them my PICO, and I also shared with them the data from the review of our cases. And we looked at our organizational data and really pulled the data in regards to our performance management goal towards achieving adoption for our children within 24 months and being able to improve that percentage. We talked about the back history of Fairfax County and some of the data that we wanted to improve. And I conducted a buy-in input discussion with supervisors around what they felt they needed to have as a tool to be able to impact the work when they met with their staff. I completed a draft of a supervisor tool and conducted a pilot with the supervisor tool between the months of June and July. So a little bit about my tool. It's a guided supervision coaching model that's informed by clinical supervision framework. So we wanted to make sure that it included key conversations that supervisors have with staff in support of permanency planning for children. And the focus really needed to look at some of the key areas that I talked about earlier. How are we engaging fathers and relatives? How are we supporting our foster families? How are we concurrently planning? And how are we supporting our youth at the table? And documenting those areas on each timeline of the case. Some of the key components of our tool included the strengths of the case, the strengths of the child, and the strengths of the family. Really looking at whether a child is achieving safety and belonging, and with whom, and how do we know this? Protective factors for the child and the family. Who is the resource in the family? Who's comprising the family, and who are the supports that support that family and that child? The genogram. What are the complicating issues? And these are key to looking at the next steps. If we know what the barriers are, then we can help support our staff around next steps and hold ourselves accountable. And being able to document that so that anyone that could pick up the case can see where we are at any point. One main thing that I wanted to mention is that this guide is also in conjunction with a tool that we are using within foster care and adoption that we incorporated from Sue Lowback, who's supporting our program in developing a tool that we use to have team decision making, so that one supervisor and one worker are not the only ones making decisions, but that we're making decisions as a team. And that tool is also used within family work, as well as meetings that we have throughout the life of the case. So I just wanted to mention that. Her name is Sue Lowback. She's a PhD and executive director of the KVC Institute of Health and Systems in Minnesota. So I wanted to share with you some feedback on our pilot. What did we learn? Some of the strengths and challenges of the tool, whether supervisors felt it was effective, and if they felt it was useful. So I completed a survey that I sent out to the supervisors after our 6-week pilot of the tool. And some of the questions that were asked were, in the last month or 6 weeks, how many times have you used the framework within supervision with your staff? And the mean was 13 times. So within the 6-week time frame, our supervisors utilized around 13 times the tool that we were piloting. How many cases did you utilize the supervisor case consultation framework with during supervision? And the mean was 11.3 cases. And last, how many of your staff did you use the supervisor consultation framework with during sessions? And the mean was 3.8 staff. So additional data that I thought was interesting around the effectiveness and usefulness of the tool. And one of the questions that we asked around effectiveness was whether supervisors felt it helped them focus on best practice with staff. So some of those key practice areas that we know impact permanency: relative and father engagement, concurrent planning, treatment assessment, trauma-informed care. And it was pretty much even across the board. 33% felt that it was very effective, 33% effective, and 33% sort of on the fence, neither effective nor effective. In addition, we asked, how helpful do you think your staff found this particular tool during supervision? And I thought it was very interesting that on average, the supervisors and staff felt that it was helpful. So over 66% helpful or very helpful in that regard. 16% neither helpful or not, and 16% not too helpful. So I thought it was important to share what our supervisors' ideas and thoughts were in regards to their use of the tool during their supervisory sessions with staff. And this feedback came from my feedback sessions with them that I had biweekly, as well as from the supervisor survey that they completed. And the supervisors were really excited about this opportunity. They were very supportive of this process. and felt that there was a need for supervisors to document how they were impacting their case and supporting their staff and being accountable for how things were moving forward towards permanency. I think where we struggled was being able to document it well and being able to support the plan and making it consistent so that at any point in time, there was a more footprint on the case on how supervisors were being able to document their efforts in supporting the goal for our children and youth. They felt that it highlighted the practice areas that we all agree were important in strengths and barriers towards the goal, and it helped them be able to develop action steps around those areas of practice. They also felt that it was easy to upload to our data system, which is called Documentum. All our cases are on online system. We don't do large files anymore. So at any point, anyone could go into our data system and be able to pull their tool. They felt it was helpful to keep the conversation focused during the timelines that we were talking about. So at the 5-day, the DISPO, the 6-month, the 12-month permanency planning hearing, being able to be intentional and focused during those timelines around what needed to happen for our children and our youth. And they also felt that the framework was useful in being able to maintain organization and be able to focus on areas that they were seeing for growth with staff, clinical issues that were coming up, some of the grays that we are able to identify that we don't know, and how we are able to develop next steps based on all that information. So what are we going to do next based on this experience? How are we going to be able to affect change and be able to incorporate this within the work that we do? So what we agreed to as an agency is that we are going to conduct ongoing monthly reviews of our cases, specifically myself, some of the supervisors and staff, pulling 1 or 2 cases a month to be able to look at whether we're seeing an improvement in the work that we're doing. And we also agree to do a larger review at the 6-month mark to have a more significant idea of whether we're seeing an improvement in the work. We are also going to look at outcomes from the state performance scorecard on whether we're seeing our data improve at the state level and how that is impacting our children and families. So before I talk about the impact that this whole experience has had on myself, I did want to share some really good news that I thought was important for all of you to hear, that since July of 2019 through July of 2020, as I mentioned earlier in my presentation, we were at 20% of our youth with the goal of adoption achieving permanency within 24 months. And as I mentioned prior to, our goal was to improve that to 35%. Our state goal, I believe, is 45%. So as of July 2020 through July 2021, when we pulled the data in July, we were at 52% of our youth with the goal of adoption finalizing within 24 months. So since the institute of my MPLD project and the work that I was doing within Fairfax County, we've been able to improve our permanency finalization performance significantly from 20% to 50%, 52%. And I believe this past month, it dipped slightly lower to 48%, but we are still on target. So I just wanted to share that fantastic news. Yay! So what I've learned from this process is I can do data. I was scared of data, and Sharon Lynn was laughing, but it was not my first love. And I learned that data really does help us be able to speak to what we're seeing. I think as social workers, we tend to love the storytelling. And I think we've learned over the years, because I was a part of several different leadership fellowships, that data is really key to helping us move the needle towards the goal that we're trying to achieve together. So professionally, I'm not afraid of data anymore, and I understand how it works. and how it can help me on a daily basis as a supervisor in support of my team. As well as learning about myself and being able to speak up and be able to share with confidence what I'm seeing and how I can have a voice towards the work that we're trying to impact. I was proud that my supervisor supported me and felt that this was important work for them as well. As I mentioned before, really expanding and developing my research knowledge and skills and being able to have confidence in understanding that I had the ability to do that. And then really collaborating with my fellows and being able to hear what was happening in other jurisdictions and states to be able to bring that back to my agency. And last, really self-reflection, being able to go through this process both through research, but also clinically looking at yourself as a leader and be able to self-reflect on where you can improve and the areas that you're doing well in to be able to support your team and your agency. So overall, I thought this was a fantastic experience. I'm definitely going to be sharing this with my colleagues and being able to influence others to take this opportunity in the future. So I just wanted to share a little bit about my references. I pulled data from our state VDSS data system, as well as our local data system that we are tracking our data from, as well as the model that we incorporated from KVC to be able to develop our supervisory tool.